Well, hello again. This is Dr. Kevin Connors. This is part 3 of beating chronic Lyme, talking about the 3 phases of Lyme disease. Wonderful information. So, if you don't have Lyme disease, this might all be new to you. If you do have Lyme disease, much of this will be review, hopefully. All right, so we talked about the acute stage last week, and that many times it goes completely unnoticed. So the initial infection can go completely unnoticed, and you can move. Many times I have patients that come in that are in chronic stage or autoimmune stage Lyme, and they never knew it. Many times I have patients that have had Lyme, that have had horrible debilitating symptoms for years, and we discover it's Lyme disease. So I'll pretty much guarantee that a large percentage of people with MS, a large percentage of people with ALS, a large percentage of people that have neurological symptoms, neurological inflammation, neurological disorders, it can stem from Lyme disease. So, and that never even crosses their mind. So there are people dying from diseases of different names that actually had Lyme disease. Sad but true. So we talked about that acute phase and that there is a window, and that window of opportunity to kill it with an antibiotic can be slim, and it's different for everybody. So it might be good to know a Lyme literate doctor in your area and develop a relationship with them, even if you do not have Lyme, so that you could use their services in case you have the symptoms. We discussed again, and I will reiterate, my opinion is to use an antibiotic if you can communicate and have a relationship with a Lyme literate doctor, even if you have the symptoms during Lyme season. Don't wait for the tests. The tests are highly inaccurate. We'll have a discussion just specifically on those in the future. So you can't wait for the tests. So the second phase of Lyme, so the acute phase is the initial phase. That's phase 1 or stage 1, whatever you want to call it. The second phase, phase 2, stage 2, is called chronic Lyme disease. And people can stay in this chronic Lyme disease stage, this phase 2, for years, for decades. So they may never move to stage 3. In the chronic Lyme disease stage, it's defined by my definition as when any bacteria goes intracellular. So when any bacteria goes inside the cell, now it's in the chronic Lyme disease stage. So you may have heard, or maybe you, or you know someone, who was quote-unquote cured of Lyme disease using antibiotics long-term. So they were on antibiotics for 4 or 5 years, and they feel like they really have the Lyme disease licked, and they are, that was 10 years ago, and they are doing just fine. That is true. You can do that. But the problem is that once the Lyme disease goes intracellular, antibiotics won't work. But it won't work on the bacteria that are intracellular. But as soon as it goes extracellular, tries to reproduce and make you very sick, if you have circulating antibiotics in your system, it will kill it. So if you're on antibiotics long term, that is another way to deal with chronic Lyme disease, because as soon as that bacteria goes extracellular, you're going to kill it with the antibiotics. The negative about doing that is that antibiotics are so harmful to the rest of your body to go on them long term like that. If you're taking antibiotics on a 10-day phase, that can be damaging to your gut. Taking it on a phase that you're doing it over the course of years, or months or years, it's just horribly damaging to your gut. So it's not something that I would ever recommend. But I understand that people are desperate and they don't know any other way to deal with it. So, but chronic Lyme disease is defined as the bacteria going intracellular. So once it goes intracellular, it can reproduce in the cell, it can damage the cell itself, and it can then go extracellular. As soon as the immune system is suppressed a little bit, goes extracellular, and starts to reproduce extracellularly. So a person typically has symptoms with Lyme disease that are undulating. That means they'll have some good days and they'll have bad days. They'll have a little better day, then they'll have bad days. It is really on the better day when their immune system is firing up to kill that bacteria and it's cleared it out of the extracellular spaces, so they feel pretty good that day, and then their immune system suppresses as it's constantly in this uproar of a fight against this insidious bacteria, that it's you have these undulating days, and it's very confusing for the person. In the chronic stage Lyme, it has yet to go to phase 3. You can kill it with antibiotics. So it is possible to use antibacterials, I mean some herbal antibacterials, in order to kill the disease. So using cat's claw and different protocols by different practitioners that typically have a lot of different Th1 stimulators. So let me explain that. So you have two sides of your immune system. We'll get into this in the next presentation in depth. But you have two sides of your immune system. You have your initial response immune system, your Th1 response. That is the response that is the killer side. So think of your Th1 response as the Marine Corps with machine guns. So they're out there looking for the enemy, and they're going to kill the enemy. The only thing the Th1 response does is kill things. So the Th1 response doesn't capture the enemy and bring it out of the body. The Th1 response doesn't locate the enemy and make friends with it and try to communicate. The Th1 response kills it. That's all it does. So you got the macrophages, the white blood cells, all these different Th1 cytokines and chemokines that their only role in life is to kill bad guys. So when there's a bad guy that enters your body, aka Borrelia, Lyme disease, your immune system will fire a Th1 response in order to kill it. The bad thing about Lyme disease, again, is that it's very virulent. So it's reproducing quickly. Your Th1 response is trying to kill it. Can't kill it right away, so it fires a greater response, a greater response, a greater response. Hence, you have symptoms of fever. So a fever is a hyper Th1 response. You have swelling, you have fatigue, you feel sick, you have nausea, you have all these symptoms of a hyper Th1 response, no matter what the antigen is. So that thing which the Th1 response is firing against is called an antigen. So Lyme disease is the antigen that we're talking about. If Lyme disease hides inside the cell and your Th1 response can't kill it, that's not a good thing. So that's where you need antibiotics to help knock this down. So antibiotics are coming in there as a false Th1 response, but they kill that bacteria directly, and the immune system thinks it killed it, yay, it wins, so it goes back into normal, and now your symptoms go away and you feel good. In a chronic stage, that Borrelia goes intracellular, outside of the space between the cell, inside of the cell itself. Your immune system is firing a response, can't kill it because it's not in the extracellular space anymore. Finally, it suppresses down, and then the Borrelia goes extracellular again, starts reproducing, making you sick. The Th1 response fires again. So the purpose of taking immune stimulants like echinacea and garlic and astragalus and elderberry and on and on and on, any immune stimulus, is to help the immune system. And we're talking about the immune system, we're talking about the killer cells. We're helping the Marine Corps kill the antigen. So the whole idea, if you could think of it this way, when you take immune stimulants, you are basically arming the immune system. So you are selling arms to the immune system in order for the immune system to have the capacity to kill the antigen. Well, that's a good thing, right? Absolutely, it's a good thing. If the disease is still in the chronic state, that is a very good thing. So a person that says, oh, I don't know what your problem is, Bob. I had Lyme disease, and I took cat's claw for 3 weeks, and then I took echinacea, and it knocked it right out of me. And Bob's going, well, I did that, and I felt better for a couple of days, and it actually made me sicker, and I'm still sick. And here Bob's in the stage 3 autoimmune phase, but his friend knocked it out completely with cat's claw or elderberry or whatever little, immune stimulant that he used. Um, the reason why he knocked it out is that it was still in the chronic phase. So immune stimulants only work for Lyme disease in phase 2. Say that again. Immune stimulants, Th1 stimulants, which is known as anything that would be considered an immune stimulant. All the medicinal mushrooms, all the different herbs, vitamin C, garlic, all the things that are supposed to boost your immune system, you can Google it, are all Th1 stimulants. They are giving support to the Marine Corps to kill the Lyme disease. They will only work when you're in phase 2. So phase 2 is chronic Lyme disease that has gone intracellular. Therefore, if you're going to use an antibiotic approach, it would have to be a very long-term approach that would give you a lot of side effects. You can use an immune stimulant approach if it's still in phase 2. But once you move to phase 3, once it becomes an autoimmune disease, you're going to find out next week that you cannot use any immune stimulants at all. Because if you do use immune stimulants, and we'll hit this hard and heavy next week, you are arming your immune system. That's what immune stimulants do. You are arming your immune system to kill your own tissue. Not a good thing. So when Bob could get better taking an immune stimulant and can't figure out why his friend Sally can't get better taking an immune system, Sally is probably already moved into phase 3. Bob needs to stop being critical of Sally because Bob was able to catch it in phase 2. So just because something worked for you doesn't mean it's going to work for someone else. They may be in a different stage. Got that? Say it again. Antibiotics work in phase 1. They can work in phase 2 if you take them long term, but it has a whole lot of side effects. Immune stimulants work in phase 2. They do not and you cannot use them in phase 3 because most likely, as you'll learn next week, you are Th1 dominant. Immune stimulants work in phase 2, only in phase 2. You cannot take them in phase 3 or you will be helping your body destroy itself. You might as well just take poison if that's what you're going to do. Sorry, but that's what it is. You cannot use immune stimulants in phase 3. I'll explain that again next week, so hold your horses. If this is all new to you, listen to this again. I understand that. So here's some immune stimulants. This is a great immune stimulant capsule. See, it's got echinacea in there. Green tea is a Th2 stimulant. We'll talk about that. But astragalus, Th1 stimulant. Elderberry, Anagraphis, immune enhancer. These are all Th1 stimulants. Golden seal. All these mushrooms. Cordyceps typically isn't a Th1 stimulant, but shiitake, maitake, reishi, and beta-glucans are all Th1 stimulants. You can't take those in phase 3, but you can take them in phase 2. So, again, take home. Treat acute Lyme in phase 1 with antibiotics as soon as possible. If you do not get a fairly instant relief of your symptoms, you probably missed the window, or you're not dealing with Lyme disease. You're not dealing with the bacteria. If you know that you're not yet in the autoimmune phase, that's phase 3. If you know you're not yet in that phase 3, you can try taking immune stimulants. So they're great if you're in the chronic phase. Again, if you don't know what you're doing, make sure you call our office and you can talk to us. I hope you learned something. I know we're going super fast, but for most, this is review. For others, it's all new. Listen to it again. We'll see you next week.